Okay, in another SSO President update, today I'm joined by Dr. Callisia Clarke and Dr. Alexandra Gangi, and they are two of our board of directors. And we're going to talk about one of the projects that they've both been working on over about the last 10 or 11 months, looking at the strategic plan. So welcome, both of you.
Thanks for having us.
So obviously the big question that you can help explain is, what exactly is the strategic plan for those who really haven't seen some of the other education that we've put out about it?
So the 2023 to 2027 strategic plan was developed by the SSO membership for the SSO membership. We had about 200 volunteers who participated in multiple meetings and focus groups that really submitted responses to qualitative surveys that then helped guide the development of our plan. There were 4 strategic plans that emerged from this work, in which each theme consisted of 3 goals and several objectives to try to meet those goals over the 5 years. The project ideas were proposed by the board members, the task force, and focus groups. And all of the projects have some specific tactics that we're going to undertake. Since the launch of the plan, we've started undertaking many of these initiatives in 2023. And our goal is to really push the organization forward.
Right. So can you tell us some of the big accomplishments so far?
Sure. So I think Dr. Clarke highlighted what the strategic plan is nicely, and obviously we can't highlight everything that we've done, but a few key programs from each of the pillars we'd love to go over. So Pillar 1 was essentially to increase the SSO's impact worldwide, and within that pillar, we've made membership free for international trainees, which has increased our presence globally and provides free resources to trainees from around the world. We've signed MOUs with 4 new global partner societies, which include organizations in Africa for the first time, so that's very exciting. In addition to the African Organization for Research and Training in Cancer, they include the College of Surgeons in the East, Central, and South Africa, the Taiwan Breast Surgical Society, and the West African College of Surgeons. The second pillar has been to enhance the member experience. And again, we can't highlight all of the programs, but one area that we focused on is the Women in Cancer Surgery. Within this, the program's mission is to create a community for women cancer surgeons and develop a variety of resources and tools that they can utilize for their personal and professional goals. Within this, there are definitely webinars and podcasts on topics ranging from burnout, mindfulness and resilience to finances. There is a website in place on the SSO website that can give you the direct link so that you can see what other areas are available to further review. And then I think Callisia is going to highlight some additional ones.
So Pillar 3 was really focused on advancing equitable patient-centered care. And we wanted to cement our role as sort of experts in the field of oncology. So the SSO has developed and published our first consensus statement in 2024, which is assessing the evidence for and utility of gene expression profiling for primary cutaneous melanoma. We've also worked to increase our partnerships with a lot of our sister organizations. These include ASBRS, ASTRO, ASCO, NANETS, and many of our global partner societies, as Alex already mentioned. And we're trying to develop webinars, podcasts, joint guidelines, editorials that really make us stronger all together, but ensuring that the SSO is at the forefront of all of the treatment recommendations and resources that are available. We also continue to support groundbreaking research with our early investigator initiatives and programs. And this year, we actually secured additional funding for a second CIA program. The final pillar is driving the future of cancer care. And essentially, we launched 3 new mentorship programs this year that's really working to promote the diversity of the workforce pipeline for surgical oncology, and also provide our early and mid-career members with career and leadership development opportunities. The Career Catalyst Mentorship Program, the Presidential Scholars Program, and the Foster of the Future programs are basically all focused on physicians at different stages in their career. But essentially, our goal is to ensure that we have a strong future of surgical oncology and a strong pipeline of leadership in the Society of Surgical Oncology.
Yeah, it's a lot, right? There's a lot of exciting things going on, and I'll just make a comment on a few of them. The membership is going up a lot, and even in some less advantaged countries, we're going to reduce even for faculty level potential members the annual dues. We're putting together a map to show really how global the SSO is becoming. You mentioned a few of the new memorandums of understanding with a couple of the African groups, but it's really spanning the globe now. It's quite impressive. Women in surgery continues to be a big part of what we're doing at the meeting, of course, and even throughout the year. Equitable care, definitely. ASBRS, I think, has been an enormous amount of progress with them over the last 2 years, and now the fellowship is jointly sponsored and governed. And then all the leadership courses that you mentioned. So there's still lots to do, but what do you look at this next year as sort of the big targets?
And I think we've highlighted some areas that are certainly ongoing. One of these being kind of developing a tiered giving program for research and education funds, which aims to encourage our members to continue to give generously and support the future of surgical oncology research. There have also been some presidential initiatives. Some of these include increasing engagement for resident and medical student members through the presidential initiative. And I think we've also highlighted some individuals who applied for, directed mentorship moving forward throughout the year. Additionally, we are working on involving our surgeon APPs. So there's a task force that was appointed last year for our APP group, and we've developed specific programming with additional plans to roll this out further that are under development. And then lastly, there's a surgical oncology sustainability task force that was put together again as a presidential initiative. And this group has been very hard at work. You may have seen their sustainability nuggets in the new SSO newsletter. If you haven't, certainly go back and look at that. But they're working on multiple projects related to sustainability in healthcare.
Terrific. Well, thank you both. You're keeping track of everything happening with the strategic plan and helping to drive it forward. And we should enjoy the next 2 years or year and a half, because then we're going to have to come up with yet another strategic plan. So thanks very much for joining us tonight.